We actually have a whole host of assets, strengths, and insights that are contributable from our community that we're blessed with. And I believe those need to be leveraged and capitalized on by our policymakers and funding model designers to better utilize whatever is already there, which includes a lot of expertise, experience, and models and techniques that current funding model has not explored. In terms of actions that are required to be taken to address those challenges, I believe our policy designers and funding model analysts are can be actually more open to debunk the current sort of what I call the medical monopoly, right? So for mental health, it does not have to be medical and it does not have to be a monopoly. The first line of defense does not need to be primary care nor psychiatric hospitals. There are a lot of community based, grassroots, storefront type service centers that are equipped with psychotherapy, non pharmacological services that are more attuned to the local needs in terms of local, geographical, and as well as socio-cultural and linguistic needs. So the next step would be for policy developers to actually engage in an active dialogue with these service providers and leverage their expertise. So it becomes sort of a triple P type partnership where these providers can be empowered to deliver services to address the mental health crisis that is in the province, the same way funders would normally just as a first concept or the first idea to engage with primary care or a psychiatric hospital. I think the community level providers are actually a more cost effective way and a more a less stigmatized way that is somewhat barrier free for our population to access services from versus for newcomers or racialized populations to think of mental health as primary care or hospitals at their first step. I think if our policymakers are interested in engaging in some such a dialogue or empower these service providers, it would actually build a much bigger continuum of services that would actually more in a wraparound way address the mental health needs of our community.